think it has to remind us that this virus isn't quite over. I mean, people ask, when is the second wave going to happen? We have to remind them, well, the first wave isn't quite over. I mean, the number of cases is certainly going down here in Canada. Most provinces are seeing zero or very few cases. Quebec and Ontario obviously still seeing quite a few, although those numbers are down. So things are definitely better. But we sometimes have a very myopic view of the world, and we say, well, things are doing better in Canada. That means things are going well. Things are not going well in many other countries, and specifically what you mentioned, Brazil is seeing a lot of new cases. The U.S., of course, especially in the South, seeing a lot of new cases. India as well. So, across the globe, and we have to realize we're living on, an increasingly smaller planet. There's still a lot of people getting sick, and so the possibility that we're going to see resurgence of virus is very, very high, because it's not going to take much for the virus to spread from one country to another, especially if we start relaxing travel restrictions. Yeah, very significant in terms of contemplating travel. But you said something really interesting just at the start. Many people wonder, when is this second wave coming, or is this a second wave? You're suggesting we're not done with the first yet. Right, exactly. When we talk about second wave, what we generally mean is, okay, you have an influx of cases, the number of cases go down, and then the number of cases goes down to zero, or to essentially zero. And then at some time in the future, you have a second wave where you have a new resurgence of cases. And that has to be differentiated from a second peak, if you will, which is within the first wave, the cases can go up, go down, and then go up again. So when you have a second peak, it means that the virus has never really gone away. In our case here, specifically if you look at Ontario and Quebec, the number of cases are down, but they've never really gone away. So if the number of cases starts to go up again, let's say theoretically, now that society is reopened, that wouldn't technically be a second wave. It would be a second peak within the first wave, because we never had cases go down to the zero mark. I mean, that distinction is maybe a little bit academic for most people. Most people just want to know if the cases are going up or down. But I think the important point, again, is to highlight again, is that the virus has not gone away. It's still out there. And so while we're a little bit more relaxed and maybe, and even though we're reopening society, bear in mind that the virus is still circulating. So if you're a high-risk person, or you come into contact with high-risk people, maybe be a little bit more careful. Masks, physical distancing, hand hygiene, all of those things still very much apply. But when you say society is reopening, indeed we are. We're talking about Saskatchewan moving into phase 4 today of reopening. And here's a couple of other signs. Over the weekend, we saw lots of people in Nova Scotia on the beach. We have pictures of that. And also today, 6 Toronto beaches open. So I'm wondering, this will be a big draw for people. It's so warm and summery outside right now. What do people need to keep in mind, Dr. Labos, as they hit the beach? Yeah, so the biggest concern when you're at the beach is people crowding together on the beaches. The number of beaches is generally finite, especially when you're talking about beaches near cities. So when you talk about Toronto and the waterfront, you're going to have a lot of people trying to crowd into a very small surface area, because there's not that many available beaches in Toronto. So it's not so much the water. People, always ask, can the virus be transmitted by swimming? If I swim in the same place where somebody else who's positive is swimming, and that's probably not the case. At least not anything that we've seen. I would still keep a certain distance, but it's more about the number of people coming together. So if you are going to go to the beach, as long as you can maintain a distance from other people, remember that famous 2-meter bubble. So as long as you can stay 2 meters away from someone, you should be okay, and there doesn't seem to be much of a concern about it being transmitted in water. That being said, most of this was drawn from when people were talking about pools, because remember, this sort of happened in the winter months, pools that are usually chlorinated and treated. Whether this is going to hold true in open water that's untreated, still somewhat unclear. It would probably be okay, but I don't think anybody's really certain about that. And again, probably better to keep your distance, and I probably wouldn't want to be swimming very close to somebody who's sick, because there is some evidence that the virus can be shed in stool and from fecal matter. So there's always the possibility that you might contaminate a water source. So we have to be maybe a little bit careful about this. Okay, that's it. I mean, we still know only so much about this virus. So caution still at this point until things are definitive. Let me ask you one other thing to conclude. I want to find out about sports. All of the pro sports clamoring to get back in action, and the fans want it. Well, we've just had
2 tennis players at an exhibition tour organized by Novak Djokovic. We're going to show you Grigor Dimitrov, the biggest name. He's been infected. And as I said, a second also. Over the weekend, Austin Matthews, the big Maple Leaf star, tested positive. NHL's worst nightmare. Major League Baseball, reportedly 40 players and staffers positive. Tampa Bay Buccaneers, that's NFL, positive cases in their camps as well. And here they are, the leagues going ahead with trying to get back to action. Does that seem wise, or should they be stepping back from this, Dr. Labos?
I mean, they should probably be stepping back. If you think of the logistics involved in doing organized sports, the number of people that have to be involved, it's just very, very high. I mean, even if you, obviously for team sports, you're going to have a bunch of players together in close contact. So one of them gets sick, you know, it's going to spread very quickly. But even if you set that aside, and even if you set aside the crowds, right, so you're not going to have spectators in the stands. Even if you set that aside, if all you're going to do is have sporting events that are televised, the number of people that have to be involved in televising a sporting event is quite high. So even if you take the best case scenario, something like tennis, where the competitors are really not coming into contact with each other, the only contact they're going to have is touching the ball, which, you know, in theory can be easily worked around by having them wash their hands and disinfect their hands. Even if you take that scenario, just the number of people that have to be involved to televise a tennis match is quite high. So you're going to have people coming into contact with each other. So I understand how important sports are to many people, but we have to realize that if we start doing this, we're going to start putting people at risk, and there's going to be a possibility that the virus can spread. So there are a lot of factors that go into this that are going to make it hard to do it safely. And I think we have to understand that if we start asking for sporting events, we are going to maybe see new cases amongst the athletes, but also amongst the support staff that work for them, all the coaches, all the trainers, all the cameramen, all the people involved in putting a sporting event together. So we have to realize that there are going to be some risks, and maybe this is not the time, especially as the number of cases is going up.